rise will happen in healthcare in the next 6 months? Good or bad?
Well, I mean, we all know what happened last week with a giant breach that Optum had. That's to no fault of any single organization. But I've always said and have told my colleagues that our biggest threat, even from a security standpoint, is through healthcare systems. I think a lot of times people forget that what do our medical records have? Our medical records have obviously our name, social security number, addresses, method of payment, next of kin. So it's no shocker that that's what's happening. We've had other healthcare systems been breached before. I think this is the biggest thing. I think sometimes it happens and then we just brush it underneath the carpet. This is something we have to be very diligent about. This is why, secure communication platforms are going to be, right now they're probably just salivating right now. They're like, oh, this is great. New technologies and telehealth. We just have to make sure everything's secure, because whether it's a domestic threat or international threat, they're all coming for our records. So
I think that digital transformation has long been at work in healthcare, but over the course of the next 6 months, I think we've got the opportunity to witness a number of ways in which we'll go from the Flintstones to the Jetsons. AI and aided by AI, I think we've got an opportunity to move technical, quantitative reasoning beyond the scope of clinical care and into solving administrative and operational logistical sickness just as heavily.
Yeah, so we spend most of our time at Duos working with Medicare Advantage plans and working directly with the older adults that are part of those plans and their caregivers. And so we track what's going on within that landscape really closely. And one of the most important changes that we see coming right now is that the benefits in those plans and the cost of those plans is going to end up resulting in a downward trend on the amount of benefit and an increase on the amount of costs that the average older adult is going to be paying for those plans. And the exact number is going to be right around $396 to $400, either more expensive or less benefits in those plans, because the federal government is paying less money to the Medicare Advantage insurers. And so those impacts are going to start to impact the consumers and the older adults, which we worry about, because 88% of the people that we work with at Duos, they make less than $28,000 a year. And so any impact to their benefits or an increase to their costs of those Medicare Advantage plans is going to be really hard for those individuals to deal with on a day-to-day basis.
Well, one of the things we've been researching at EY is the effect of AI on the inpatient setting. And one of the use cases that we think is really growing and people need to know about is the fact that we're starting to see more remote patient monitoring in the inpatient setting. And this is significant for lots of reasons, but first and foremost, we have continuous monitoring of vitals with AI embedded to watch for early declines of patients. This saves for the workforce walking around the wards and taking the vitals manually. This is going to be a huge savings, but more importantly, it's going to allow for patients to actually not decline within an inpatient setting. They'll have those interventions earlier and be able to be discharged to home.
Well, I think people are going to realize that large language models are not the answer to everything. They're underestimating their complexity, the amount of human input that's required to manage their output. And also they're computationally quite intensive, and their output is unpredictable. So when you combine all that, I think there are a lot of areas where they can help, but there are a lot of other areas where existing AI tools that are more mainstream and more predictable and deterministic are going to do a better job.
So I think that maybe there's a little bit of a wish list, putting positive thoughts into the air. I think that what would be great to see happen would be actual payers, providers, taking the wave of regulation that's heading our way seriously and understanding that this isn't about technology adoption. This really is about how are we transforming our businesses for the, for the next 10 or 20 years of how we're going to work. I think if that doesn't come true, what would be great is to see some enforcement around information blocking, which I believe will provide the alignment needed to do that.
Well, I think when you look at a lot of the state regulations that have been coming out specific to hospital systems, New York was the first when they announced it December of last year. There's a number of other states that are really trying to up the game because HIPAA is no longer enough. So as it relates to the cybersecurity and information security requirements, I think we'll continue to see a number of states put requirements in place for all hospital systems to protect critical infrastructure and their state patients.
Yeah, I think sticking with the same theme of technology, how are we embracing the technology changes? How are we looking and adapting to the healthcare professionals and their flexibility and using that to our advantage? We have to adapt to the changing of the technology. How do we use that? How do we embrace that? But also provide the flexibility that the healthcare professionals are looking for.
Okay, I have gotten out of the prediction business and I have embraced a different sort of philosophy. One of my mentors wrote about this a couple of years ago at the height of the pandemic. And he wrote, "Fate will not create the new normal, choices will." So I have focused, and what I really want to see happen over the next couple of months is for us as leaders in healthcare to not talk about predictions or wishes or hopes, but actually about the choices that we as leaders are going to make to see the difference in healthcare that we want to see. So at Teladoc Health, one very explicit choice that we are making is to widen the aperture around conversations related to health equity and digital health. So often the focus is on access. People say, well, we've got a smartphone, health equity solved. Just because you have access to something does not make it accessible or affordable. So we are focused on ensuring that everyone has equitable access to our products and services of differing abilities, that their experiences are equitable based on their individual needs, preferences, and circumstances, and that everyone is getting equitable clinical outcomes. So our focus, our intention, our choices over the next few months very deliberately are about positioning us to deliver equitable access, experiences, and outcomes for all.